So now, having said that, let's look at the health care bill. A mandate that if you don't take it, you're a single person, you'll be fined. Now the question is, will Americans buy the health insurance or opt for the fine because the fine might be less than the cost of the health insurance? So let's look at the needs of health insurance. Number one, I think you have approximately 12, maybe 14 million people. I don't know. I don't believe their figures. I don't really think they could run a census in this country. I think there's a hell of a lot more people in there saying there is.
Oh, absolutely.
And they're voting.
Yes.
But I think there's maybe 12 to 14 million working families, working people that do not have health insurance. That is a need that should be addressed. Number two, I believe there's a like amount, perhaps 12 million individuals that are uninsurable because of these pre-existing conditions. And I think something must be done, not only for them, but actually for the people who absorb the cost, the average taxpayer. Now the government says we have 36 million people who need health insurance. The other 12 million, they say, are the young people that simply do not purchase the insurance, and at times end up in a hospital emergency room causing cost problems for the American people. Well, let's just look first at that 12 million, because first of all, there's not 36 million. There's more like 50 million plus. And I'll get to the group that's not being discussed in this bill. Let's talk about that young person. I want each and every one of you to think, before you had an employer, if you had an employer that paid your benefits and insurance, if you did not, when you were 20 years old, 21, 22, 19, entering the workforce, was the first priority on your personal budget the purchase of health insurance? No, it wasn't. The luxury of youth, willing to roll the dice due to health and good health. I didn't buy insurance. I doubt if most people did buy health insurance at that young age. See, I don't think they should be mandated to buy insurance. Now, if they want to roll the dice, they have that right and that freedom. And if something happens, God forbid, they got to pay for it, don't they? But the chances of it happening are fairly remote compared to other stratification of consumers of health services in this country. So many of them will just opt to pay a lesser fine. Now, what does that serve? They don't have insurance, they're going to go an easier route, because America, regardless of what anybody says, is concerned about price. Let's tell it like it is. That's what makes our system go, and that price factor drives competitiveness. It drives the free economy of a capitalist system, which we should be proud of. Profit's not a dirty word. So you have the youth that will face the mandate. You have the pre-existing conditions that will no more than likely end up on that public option, because those insurance companies, their job is to make a profit, and they've been ripping pretty good, and they brought about this debacle themselves from some of their predatory behavior. But you see, there's another block out there, about 12 to 15 million people consuming health services in America. They're illegal immigrants. There's no mention in this bill. They're saying, well, it doesn't cover illegal immigrants. Let me ask you something. If you work in a hospital and a person comes in and has a driver's license and social security card, you're going to treat him. He appears for welfare. Is he going to qualify? They don't even know how many people are in this country illegally. Now, if you jump the border illegally in North Korea, you go to prison for 12 years. You jump the fence in Iran, you're never heard of again. nearly every country in the world has strict laws dealing with illegal penetration of their borders. Now forget the target population I'm addressing. Listen to the words. Our country allows unlimited penetration of our border by non-citizens. And both these parties are catering to these powerful minority now, a bigger block of votes in the black community, wanting those votes to maintain majority and perpetuity for their re-election. Who's going to pay for those 15 million? See, I believe in the old-fashioned way, and here's exactly the way I think it should be done. Anything that could be done in the private sector should and shall be done in the private sector, not the government. See, I believe the federal government handles macroeconomic issues. They shouldn't micromanage a lot of the things that they do. And let's look at what our federal government should do. Number one, national security. Now you have them approving at 11 airports only, just 11 so far. 1,000 full-body scanners and $160,000 apiece. Look at the money. And our borders are wide open.
Yeah.
And folks, let me tell you something. They can build a wall, they can build a fence. They can have agreements with Mexico all they want. They can hire Border Patrol. They'll burrow underneath that fence, and there's one Border Patrol for every 2 miles of border. Think about it now. Think about where you live, and think of a spot affixed, there's one Border Patrol agent responsible for that. I was in the hole in Ellenwood with a guy that was an illegal immigrant that was caught with tons, bringing in tons of marijuana. And I said to him, I says, what are you going to do when you get out? He said, I'm going to make one more hit. And I'm going to retire. I said, well, how are you going to make one more hit of that size? He said they have 40, 50 people that put 40 to 50 pounds on their back. They go to the border and they get paid a good price. They wait for it's clear, they cross the border and give the narcotics, that in this case was marijuana, to their counterpart operative in the States. How are they going to stop it? When I said let's put troops on our border, let's just talk about that. Our troops are guarding the borders in the Mideast. Our troops are stationed throughout Europe and Japan. They're going to the theater in Japan. They're going to eat in Germany and Italy. Going to the opera. Our borders are wide open. And I'm not just talking about the southern border. That northern border is wide open. What, if anything else, is the first national security checkpoint of this nation? Our border. But the politics of elections has kept our borders wide open. Don't try and change it, you're a bigot. You just don't like Hispanics, Traficant. They just want to make a living too. So the woman comes over, 8.5 weeks, has the baby's a citizen, mother stays with him. What do you do about that, Traficant? Listen carefully, it sounds very brutal. If it was determined that a woman came over in her last term for the purpose of gaining citizenship for her infant and for her to stay here, the law should be changed and she should be sent back. It may sound hard, but if America is not solvent, America can't handle the world. America can't help anybody else. Second of all, what are we doing helping everybody else?